presented by NanoShield antimicrobial film. For more information about this new age infection prevention application, please see the description below. Attention, daycare facilities and primary schools. The CDC has documented a startling surge in whooping cough cases that has gripped the US, with over 32,000 cases reported in 2024 alone, the highest in a decade. In just 12 weeks before December 14th, as many cases were reported as had been counted for the entire year until then. Last year, only about 5,100 cases had been recorded by this time, highlighting the alarming rise. Multiple regions are experiencing surges, leading to warnings and even the early shutdown of a school district in Oklahoma. Experts point to lower vaccination rates, fading vaccine protection, and improved testing as key factors behind the increase. During the COVID pandemic, reported numbers were well below average, making this year's spike even more concerning. Whooping cough is most severe in the youngest children, especially those under 6 months old, with tragic outcomes in some cases. The CDC recommends vaccines starting at 2 months old, with booster shots for older children and adults every 10 years. Parents are urged to vaccinate their children and take the threat seriously, as symptoms can be mistaken for a common cold. Clear and consistent messaging about vaccines is crucial to combat this preventable yet deadly disease. How is whooping cough transmitted? Whooping cough is primarily transmitted person to person. As a secondary infection source, this highly transmittable bacteria can also be transmitted by touching an infected surface and then touching your face, nose, or mouth. The bacteria that causes whooping cough, Bordetella pertussis, can survive on dry objects for 2 to 5 days. When an infected person coughs or sneezes, they release respiratory droplets containing the bacteria, which can land on surfaces. If a person touches these contaminated surfaces and then touches their face, they may become infected. How can NanoShield antimicrobial film help? NanoShield is a self-disinfecting transparent antimicrobial film that can be applied to various high-touch surfaces around the home and in public facilities like daycare centers, primary schools, school buses, and more to continuously destroy viruses and bacteria 24 hours a day, 7 days a week, for up to 12 months at a time. You can elevate your infection control strategy with NanoShield AM as your frontline defense in the battle against infectious disease transmission. This cutting-edge solution doesn't just complement your existing protocols, it serves as a powerful first-line barrier, actively working to neutralize pathogens 24 hours a day. While not specifically tested against Bordetella pertussis, NanoShield AM has demonstrated effectiveness against a wide range of pathogens, including SARS-CoV-2, influenza, Escherichia coli, Staphylococcus, norovirus 2 and more. For more about how this innovative and cost-effective form of infection control and how it can help keep your families and facilities safe, please check the description box below.